Hello and a very warm welcome to all to this second day of our ISNTD Climate and Health Conference. I'm Marianne Comparate on behalf of the International Society for Neglected Tropical Diseases, and I just want to welcome you really warmly to this event. It's been a fabulous event. It's been really enriching in this run-up to COP27. We've been exploring a lot of the linkages between climate change and diseases, with a particular focus on infectious and tropical diseases. Yesterday, just to summarize very briefly, we heard some really stark reminders about the evidence linking climate and health. We had presentations of work covering a variety of diseases and perspectives from a range of countries and regions, all with this really one clear message, which is that the climate crisis is fast becoming the biggest health threat to humans. So that's this kind of the starting point, this point of emergency. And so today we're turning to some really exciting solutions. We'll seek to understand ways in which the two sectors can better work together, with some really great examples of partnerships and philanthropic support in this field. In fact, perhaps you yourself as an attendee are here because you might be wondering how to include climate change impact into your own research on health or diseases. So we'll also hear more about methodologies, whether that's in terms of modeling, programmatic integration, basic research, and so forth. And we do hope that throughout the sessions and today, the three sessions of this day, one clear point will stand out, and that is that climate change disproportionately affects the world's most vulnerable, and neglected tropical diseases too disproportionately affect the world's most vulnerable. So although health impacts of climate change are increasingly part of the wider climate discussions, there's a long way to go still to make this a priority. This is why we feel very strongly that the time is right to now really realize the impact that this field of global health and tropical diseases particularly can make in terms of understanding and responding to climate change, and that this ecosystem of stakeholders can be a really critical partner in terms of resilience, response, and adaptation to climate events. So in this way, with today, we're aiming to frame climate change as a global health issue, but also those working in the fields of infectious and tropical diseases as crucial partners and stakeholders in these complex climate change discussions. So with all that in mind, with that background in mind, it's my real pleasure to start off day two with some wonderful examples and some fabulous partners who've really made this work, bringing together climate, whether that be in research, R&D, advocacy, bringing together climate and health together. And so with no further delay, I'm love to launch this first session, which will really be honing in on those all-important partnerships, and then also giving us some food for thought on how to translate knowledge into action in this climate and health nexus. So over the next sort of 90 minutes or almost 2 hours, we'll be hearing a range of presentations. We also want to hear from you, the audience. If you have any comments or questions, please do go ahead, post those in the chat. Also, don't forget to tell us where you're tuning in from, where you're connecting from, your country, your organization, and we really look forward to this excellent discussion. So in the first part of the day, we're going to hear from three speakers representing different organizations tackling in their own way, bringing together climate change, and health. And then we'll be hearing about a really important funder in this space, the Wellcome Trust, and how to go from data to decision-making and policy through this very important funder's lens. So first and foremost, I'd like to welcome our speakers. So we'll be hearing first from Vanina Laurent-Ledru, who's Executive Director of Foundation S at the Sanofi Collective. Welcome, Vanina.
Thank you.
So we look forward to having you here. Then it's our absolute pleasure to welcome Joelle Tanguy. Joelle, hello and welcome. You are External Affairs Director at the Drugs for Neglected Diseases Initiative, the DNDi. welcoming Dr. Mawuli Leslie Aglanu, Research Network for NTDs or ARNTD. And in the second half of this session, we will hear from Dr. Jaspreet Turner, Senior Research Manager in Modeling at the Wellcome Trust. We'll also hear from Dr. Isabel Fletcher and Dr. Felipe Colon Gonzalez, Technology Lead at Wellcome Trust. Hi, Felipe. So thanks to everyone for joining us. Without any further ado, I'll hand over to Vanina, who will be talking to us about the Foundation S's work in addressing climate change to restore health equity. Vanina, over to you.
Thank you so much, Marianne. And so what I want to discuss today is, as we all know, the consequences of climate change on health are vast. Yet, what I want to really point the finger on is the fact that funding for health sector adaptation, including healthcare delivery, in the communities that are today most in need is largely non-existent. Today, only 0.5% of all the climate financing is going to health. And what that means is basically that we have almost a colonial approach to climate funding these days, meaning that unfortunately a lot of mitigation efforts are funded, but adaptation for communities that are today most in need, for communities that are suffering the most consequences from climate change, are very, very underfunded. The Lancet has published a piece on that, and I'm so happy that we have colleagues of the Wellcome Trust afterwards, because we will need a lot of evidence to continue advocating for this and to ensure that people realize that the time is now, not only to reduce emissions, but also to support communities where the reality of climate change is happening now. So it's what I've been saying, that the multifactorial effects of climate change have a significant impact on health. I believe that most of you may have heard the slide before, please, may have heard the experts yesterday explaining the many consequences of climate change on health. You know that an additional 250,000 deaths a year are expected to happen. But as I said, the cost to vulnerable communities is a cost for all. The direct damage cost to health, that is estimated to be between 2 and 4 billion a year by 2030, is going to impact not only people in low and middle income countries, but on the entire planet. And if we do not start by addressing this now in the communities that are the most vulnerable, then we are going to see more and more impact spreading across borders and impacting again the most vulnerable, women and children. So that's where we're starting from. That's really why at Sanofi we've taken a holistic approach for climate action and its impact on health. So what we're trying to do is really connect the dots between mitigation. If I start on the right-hand side of the slide, our company, Sanofi, a French pharmaceutical company, has been really focusing first and foremost on mitigation by building the road to carbon neutrality by 2030 and then net zero by 2050. I'll explain that in a second. We're also limiting our environmental footprint and adopting circular solutions. And finally, Sanofi as a company is working very much so to improve the environmental profile of our products, as well as adapting our portfolio to climate change. With the rise of infectious diseases and many other, it is imperative that pharmaceutical companies start designing the drugs of tomorrow and ensure that innovation can flow to this field as well. But it's not enough, and we have decided that it was high time to take a 360 approach to climate action, and that's why Foundation S, which is the new philanthropic engine of Sanofi, has decided to work a lot on adaptation by supporting vulnerable populations, adapt and build resilience to the impact of climate change. And so that's how, together with the company, Foundation S brings our climate commitment full circle by focusing on adaptation, resilience, and again, supporting the most vulnerable. So that's how we are organizing ourselves. If we move to the next slide, you will see in a little bit more detail what we're trying to do as a company. What I want to comment on is that Sanofi as a company, as I said, is working on minimizing its environmental impact. I mentioned that we're on the road to carbon neutrality by 2050. What we are already doing is reducing our carbon footprint. You see minus 27% in 2020 versus 2015. We are making all the efforts possible to reach minus 55 by 2030, and we are very much on the good road to achieve that. But it's not enough. We also need to work on our whole life cycle. And just a few examples here. We have committed, for instance, to sell and to design and sell blister-free vaccines to reduce and improve the eco-design of our selling products. We've also committed to minus 90% of water waste by 2025, so coming really around the corner. And so that's what we can do as a company. But again, ensuring that we also focus on the downstream impact and protect the most vulnerable. We basically decided to beef up our social impact strategy. And at Sanofi, we've made the decision to create 2 new entities on top of corporate responsibility. So as you know, in every company, there is now a corporate responsibility shop that is focusing very much on the or healthy planet or planetary impact that the business can have. We also decided that it was high time to complement our efforts, and to do so, we have created 2 additional units. One is called the Global Health Unit, and the Global Health Unit aims at selling 30 of our medicines at no profit, no loss prices in the 40 poorest countries. And what that does is really extending our approach on access to medicine to ensure that we can complement commercial access, if you wish, with the social access to medicine. But because we realized that it was not going to be enough, we then decided to set up Foundation S, the Sanofi Collective. You will see that we have set up this new philanthropic engine to create healthier futures for generations to come. So you see that Foundation S has been created with this vision in mind, and our mandate is really to, again, be the third pillar of access to medicine strategy, but not only. With the third pillar of access to medicine strategy by providing drugs and vaccines when it comes to humanitarian aid situations. But what we do as well is to improve lives of vulnerable populations by catalyzing community-based solutions and, as I said, expanding access to medicines globally. So what we've done is to structure Foundation S as a think and do tank. First, it was critical to establish this duet and to continue working on evidence and ensure that, particularly on this climate action and health resilience pillar, we can continue to support the evidence and data-driven initiatives that are necessary to support the need for increased funding for health and adaptation. But it's also true for the other pillars that we work on, for instance, childhood cancer. I'll comment on it in a second. We make sure that we document what we do in as much as possible. And for instance, for childhood cancer, we've just put everything that was done in the past 10 years with the previous foundation on an open platform. All that is made accessible to all. So that's the think and do take approach. And because we realize that it's also paramount to ensure that we can develop locally led solutions, we are going to set up next year a social innovation tool that will allow to direct seed funding to social innovation projects when they're not mature yet to be companies. At the Global Health Unit, we've set up an impact fund that can then pick up those projects once they mature, once they become really entrepreneurs and are ready to move on. and that's where we'll have more funding available through our impact fund. So we're trying to create this virtuous continuum to ensure that social innovation gets funding from the get-go, but that there are also bigger and bolder dollars afterwards. So in terms of commitment areas for Foundation S, I mentioned childhood cancer. What is of interest to us today is what we do on climate action and health resilience. We started by funding those local adaptation solutions I was talking about, be it in the form of both hospitals like in Bangladesh or other solutions to ensure that satellite clinics can be set up, all with a view to, again, ensure that we can respond to basic needs and contribute to restore or at least foster some kind of health equity in countries that are most impacted by climate change. The last pillar is something that we're very proud of, and not only because Joelle is on the call, but we're very proud of the commitment that the company has taken on eliminating sleeping sickness. What we do for neglected tropical diseases and particularly sleeping sickness is under the umbrella of Foundation S. And I'll say a few words on this and then you'll hear much more from Joelle. So in a nutshell, that's what we do at Foundation S. I want to say a few words now on the impact of climate change on NTDs and why we've taken that commitment on sleeping sickness. As you know, in this community, unfortunately, NTDs affect more than 1.6 billion people, mostly living in poverty. And what we're seeing is that with climate change, multiple NTDs are having changes in their transmission period, in the geographic areas. And so the uncertainties that are brought by climate change on the WHO NTD roadmap by 2030, we all need to work collectively to make sure that we can address. And that's what we've been doing on sleeping sickness, really taking that goal to eliminate the disease by 2030. We are bringing more innovation to the field. There's new armamentarium that's coming to the fore very shortly, but it's very important that we all continue to make sure that sleeping sickness sustained elimination remains a goal by 2030. And so what we are seeing in the potential impact of climate change is how the tsetse fly can spread in more areas, the change distribution in contact with animals, which will also be a factor of transmission. And for that, we'll need much more mathematical models to integrate the complex interactions of factors that are impacting NTD, and all with the view to anticipate the risk and make sure that we continue planning for this careful elimination. So again, very important to have colleagues from the Wellcome Trust on the call. At Foundation S, we will do our part on supporting data and evidence, but ultimately, as you are probably understanding, what we also are calling everybody to do is to become part of the advocacy and policy change that we all need to push for, to advocate for the most vulnerable, specifically focusing on finance for adaptation and health. We will see what's needed on sleeping sickness, but I really want to launch a call to action here to say that combating the issues of climate and its impact on health is going to require a full system change. It's going to require collaboration. It's going to require collective action across all sectors. And for me, it's extremely important that we all continue to learn and hear about the present impact of climate change on health from experts in the field, that we hear about the data, but we all should all be better equipped now to advocate to ultimately mitigate the disproportionate impact of climate change on the most vulnerable members of our society. And that's really what sleeping sickness illustrates, what this long-term public-private partnership that we've been having now for 21 years with the WHO. And we're really hoping that others can join, not necessarily on sleeping sickness, but on articulating that nexus of climate and health in every forum, so that in the end, again, more financing comes to the fore. So with this, I will hand it over to you, Marianne, and we'll be happy to take any questions afterwards. Thank you.
Thank you so much, Vanina. There was so much in there for us to think about and consider and learn from, particularly a real, very dynamic and forward-looking view at all of these issues, and also really nice to see this very unique partnership that you have with DNDi around sleeping sickness, all the way from whether it be R&D all the way to community engagement and just kind of outreach. So it's been a real eye-opener. Thank you so much for your presentation. And thank you also for mentioning the role that the health sector can make as well to mitigating climate change, because that's not something that we touched upon a lot in our discussions. We were more focused on kind of the science between climate and diseases itself. So that was a really important thing to flag. So thank you, Vanina.
Thank you.
I'll hand over now to Joelle for a presentation on DNDi's important role as a public-private partnership in bringing climate and health together. And without any delay, over to you, Joelle.
Thank you, Marianne. Can you hear me?
Very well, yep.
Excellent. So I was proposing to actually bring the perspective from DNDi, but focus more on what kind of partnerships can be very decisive in climate mitigation, but also especially climate adaptation around climate-sensitive disease. So 4 points for my presentation. The first is we'll look at climate-sensitive diseases and the looming innovation and access crisis, and what is it that the real urgency is about. And then we'll go into looking at partnerships in 3 ways: science and access partnerships for the climate-sensitive disease innovation, looking at policymakers as partners as well for change, and looking at partnerships for getting to net zero as an organization. So I don't probably need to present DNDi, but for those who don't know, we develop and accelerate access to urgently needed treatments for neglected patients. And we focus specifically on infectious disease that fuel cycle of poverty in limited resource settings. We are a patient-focused, globally networked R&D organization that was founded by a series of institutions with a critical mass of science institutions from the low and middle-income countries. We've delivered 12 treatments for 6 deadly diseases, including sleeping sickness that was just mentioned by our colleague from Sanofi. And maybe this is where I would put a bit more emphasis, is sharing with you our 4-pronged approach for climate, environment, and health R&D. Maybe this could be an inspiration, or at least a data point in others' exploration of their own strategies. What we want to do is really 4-fold. We want to develop treatment for 6 and possibly 7 climate-sensitive diseases. We'll come back to that, so I won't go in depth, but that's clearly at the heart of climate change adaptation. We want also to advocate for innovation and access for climate-sensitive disease treatment in low-resource settings, and we'll come back to that too, because that's also core to climate change adaptation. I'll put a little less emphasis, but it's an integral part of our project, is to green biomedical R&D and manufacturing, which really resonates with environmental protection. And last but not least, because it's a major institutional effort, we are committed to reduce our carbon emission and environmental footprint. And for that, we have actually a medium-term project that's already started, and for which I'm very happy to share a bit of perspective and resources that we've identified in terms of partnership. But first, let's look at what is the innovation and access challenge. I don't go into the literature review and all the explanation of what's happening, because I think you've had an earful of this over the sessions. But inevitably, I will kind of focus more into this synthetic view of what how we represent the acute innovation challenge for low resource settings. What do we mean by that? We mean that first, climate change has, among others, 3 very significant impacts on low and middle income countries. First, vector-borne and waterborne infectious diseases, such as NTDs. Second, new emerging diseases, such as zoonotic diseases. And last but not least, climate-related migration, which is not a pathogen-driven risk, but actually a reality that is already happening that exposes new population and unequipped health systems to new pathogens. And when you combine this with the fact that, one, impacts of climate change are actually already disproportionately burdening low and middle income countries, and that this will continue to be the case. And second, that the global biomedical innovation system is actually not responsive to the needs of low resource settings. And if there ever was a proof point, the COVID crisis was one. But the truth is, the real proof point in the past was the NTD crisis of innovation that a colleague from Sanofi referred to, in the sense that it took a public-private partnership collaboration to actually move forward technology to respond to sleeping sickness and other NTDs in the form of DNDi in this case. But for me, this means that in the future, we're going to revisit exactly the same, which is a crisis of innovation and access, unless we do something. So I inevitably bring you to my takeaway for the moment. And if there's only one thing you remember from this presentation, it should be this slide. One is few people are connecting the dots between climate changes and the need for medical R&D. And yet innovation to find new medicines is an integral part of climate adaptation efforts and should be recognized as such. The second takeaway is, without changes to the public policies that are shaping the R&D ecosystem, innovation will remain the privilege of the rich, while population in already burdened countries in the global south will be the hardest hit by climate-sensitive infectious disease. Maybe a good way to look at partnership, now that we've defined what the problem is, a good way to look at how partnerships can help resolve this is to first look at partnerships for innovation. And in this case, I'm going to take the example of DNDi, which is in our strategic plan for 2021-2028, we have planned to deliver at least 12 new treatments for climate-sensitive diseases by 2028. Here is actually the work plan, the ambitions, specific ambitions. You can find all this on our website. It means that we have a very practical agenda with a very clear set of deliverables that is really seeking to enhance access to treatment. For those who are less familiar, most of those diseases did not have treatments or had such toxic and outdated treatments that they became either irrelevant or even dangerous for the patients. In the case of sleeping sickness, the drug itself killed 1 out of 12 patients when I was personally involved in the sleeping sickness control programs in Uganda in the 90s. So we're looking here at a major journey of progress on this agenda, but it's an agenda that could be really reignited by the climate crisis. And that is why development of new drugs is very important. And we do this through collaborative partnerships for research and development, engaging pharmaceutical industry, health ministries, patients and communities, and treatment providers. We're particularly, as you can see, anchored in the global south. Yet we have also very significant partnership with big pharmaceutical companies. In fact, not only pharmaceutical companies, as you can see here, we're looking at research institutions in general, pharmaceutical partners, and you see here those that have contributed to building technologies in our pipeline, and as well as universities who help us through an open synthesis network. We also have partnerships with projects with IT companies and a series of broader set of pharma partners worldwide who are willing to kind of look into their their pipelines to see whether there are drugs that could be adequate for sleeping sickness. So in this process, we screened more than 4 million compounds. And maybe I'll take the example of dengue, because in fact, unknown to most people, this disease is actually the most prevalent mosquito-borne viral disease. It engages 3.9 million people at risk. 390 million people are infected annually. Are you still hearing me?
Yes, absolutely, Joelle.
Maybe most striking is the fact that there's been an 85% increase in the number of cases between 1990 and 2019, and this is further accelerating with outbreaks in all continents. And we're looking here at a situation where it's a climate sensitive, of course, a disease with a rising burden, and no treatment exists for this. A new vaccine is coming, but unfortunately, to tackle such a disease, you need actually a full armamentarium, and the treatments will be essential in controlling the spread of dengue. Hence the importance of what we're doing now, which is mobilizing South-South public collaborations as well as industry to tackle this disease. I run through a little bit of what partnerships look like with pharmaceutical partners, with scientific partners, and so on. But I want to highlight the fact that it's not only those technical partners that are really essential. Science is not sufficient to solve the problem. We need also policymakers at the table. And by that, I mean that we've learned lessons from the COVID-19 response. We've learned that participation by LMICs in setting the research agenda was really not there, that we didn't have open sharing of research knowledge and data, that we didn't have health tools free of intellectual property restrictions, we didn't have sufficient production, equitable allocation, and affordable pricing, and definitely no full transparency on R&D funding. So here is what I would like to posit be your agenda, our collective agenda in the future. First, to look at science and technology and innovation policies as well as global health policies. And because without changes to the public policies that are shaping the current ecosystem, the global south will remain the hardest hit by climate sensitive infectious diseases. So an essential part of our mission is to promote public responsibility and advocate for public policies that will enable a more effective and equitable biomedical R&D systems, delivering both on innovation and access. But the second component echoes also our previous presenter, which is it's really critical that development of new health tools to address climate sensitive diseases be prioritized within climate adaptation effort. Although there is a lot of mention of infectious disease spread as a consequence of climate change, there is very little space in the policy agenda to feature prominently this issue in discussions on climate change adaptation. And there's in fact a lot of focus, even financially, on climate change mitigation rather than adaptation. So we need to make sure that those matters are properly addressed. I just want to leave you with a vision of what a proper change in the R&D ecosystem would be, something that's need-driven, that's open and transparent, that's truly inclusive, equitable, sustainable, and in fact collaborative and coordinated, because the solution to these problems inevitably cannot be just driven by single individual for-profit agenda, but more of a collective effort that needs to engage policymakers. Hence my conclusion that policymakers are partners in moving forward this agenda and that we need to engage them. My last component of my presentation is more going back home within DNDi and introducing to you how we are going to go to net zero as an organization and the partnerships that are helping make this happen. So we've made a commitment to climate change to adopt a target reduction of 50% in direct and indirect emission by 2030. And we say this very clearly without compensation. It's very important. Otherwise, the effect on climate change is not really very decisive. We're also looking to do so. We're actually developing a climate and environmental roadmap and measuring our carbon footprint. We plan to have full transparency on our carbon emission measurement results and progress, and to share with you all the experience and the tools we've developed. In fact, our climate and environmental roadmap will work with partners structured around 5 themes: premises, travel, digital, non-R&D procurement, and last but not least, because it entails all our 200 partners worldwide, third-party activities. And to do so, we're accompanied by an interesting emerging organization called the Climate Action Accelerator. And they are actually have a track record in empowering, let's say, a range of organizations, moving a sector by sector. They moved the humanitarian sector by bringing 14 organizations from that sector together and using the experience of one organization to actually have a trigger effect in pulling the full sector. In 2022, they chose DNDi to be the partner in expanding to the health sector. And we're clearly looking here also at pioneering something that involves a lot of partners in the global south. So it's a very ambitious project, and hopefully one that will be supported to deliver. And without further ado, I'll hand over back to you. I hope you have understood that for us, the importance of climate adaptation being foremost in mind, and within climate adaptation, including R&D for global health, is R&D for climate-sensitive disease is really critical, as well as the partnerships for sciences and the partnership with policymakers in moving forward an ecosystem that is meeting the needs of the most neglected. And I'm delighted to actually hand over to also another partner, since the climate work of the global health work of the Wellcome Trust is a great supporter of DNDi.
Thank you so much, Joelle. That was, again, another very big and broad and detailed overview of how partnerships work to bring this field together, but also how an organization like DNDi is advocacy, your own climate footprint. So thank you for that. And it really stood out. You are right that very few are connecting the dots, not just between health and climate impact, but R&D particularly. So that message was received loud and clear. Thank you for that. Before we move on to the Wellcome Trust, I think, Mawuli, you've managed to join us, hopefully. We saw you appear very briefly. And if so, I'd love to hand over the floor to you.
So let me just add it. I'm a research fellow with the Neglected Tropical Diseases in Ghana, an African Research Network for Neglected Tropical Diseases, and then a PhD student at the University Medical Center in Ghana. So we're just moving to the next slide. We'll look at what NTDs are. And in the World Health Organization launched the NTD roadmap in 2021, with a specific focus on moving from vertical disease programs to cross-cutting approaches that are backed by smarter investments and partnerships. Now, if you look at the pillars, the accelerate program process, intensify cross-cutting approaches, and then changing operating models. All of these pillars emphasize collaboration, emphasize multi-sectoral action, and coordinating beyond health. So the World Health acknowledged that even tackling NTDs needs to go way beyond health and not only within that sector. So that is why climate change as an element comes in. I don't know if you can share the next screen. Yep. So the next, looking at climate change. From yesterday, we discussed how climate change is increasing vulnerability and causing various global health threats with new emerging, and infectious diseases. Now, with life expectancy in low-income areas estimated to be 18.1 years lower than high-income countries. Climate change further increases socioeconomic inequalities and health disparities across the globe. So acknowledging climate sensitivity health risk, in NTDs, we know most of the impacts include the waterborne diseases and water-related health impacts, zoonosis and vector-borne diseases. This acknowledgement brought the world together, including the formation of the One Health high-level expert panel, motivated by the FAO, the WHO, the World Health Organization, and UNEP. That is the One Health quadripartite, and with further commitment to slow down and mitigate the catastrophic effects of climate change that is happening to our climate. Now, the impact of climate change is mostly felt in lower income areas, and these areas are also high burden with NTDs. Therefore, we realize that the low income areas or the tropical areas which suffer the consequences of climate change also suffer the high burden of NTDs. Therefore, addressing climate change translates into addressing the impact on health, addressing the impact of economy, environment, and social factors. So if we neglect climate change sensitivity health risks, it means we are allowing vectors and intermediary hosts to thrive and to spread. We are seeing populations to be more exposed and more vulnerable. And also, we are making populations less likely to access the available treatment and intervention that they need. So it is imperative that we need partnerships. We need partnership from government. We need partnership from the private sector. We need partnership from NGOs and from the communities, which is very important. Most often, we consider partnerships and we eliminate the people that are actually suffering in context. So we need to actually include them. With most of the annual COP event series, bringing scientists from across the disciplines, from civil societies, politicians, the private sectors, they come together on a motivated by a common census. But more effective collaboration, action, and investment is, however, needed. But looking at these collaborative investments that is needed, one major issue is that the involvement of actors from the affected regions in leadership and driving the agenda, and then advocacy for funding and research mitigation and adaptation of strategies in One Health or One Health and climate co-benefits remain low. So we need to bring out this equity issue than looking at just equality. Now, equality is not working for these vulnerable populations because the vulnerable populations actually lack the political will, lack the political voice, and lack the necessary tools that they need. So we need to provide an equity platform to really bring them on board into leadership, to make the decisions, to make impact, and to advocate for the people that are actually suffering. So the use of One Health approach are desirable because they inherently take equity and sustainability into consideration, both in the conduct of research and in the design of interventions to strengthen climate health co-benefits, particularly in low middle income countries where the resources are poor, where they actually need these interventions. So promoting partnerships and the translation of knowledge into action from climate health nexus, we need to align priorities between all the stakeholders involved. Now, building our priorities, we need to bring funders together, we need to bring researchers together, we need NGOs together, we need international actors to actually work together in bringing this. We need to establish funding schemes towards NTD and climate co-benefits. NTD, as we already know, is already a neglected sector with very poor funding schemes. Now, climate change itself is attracting funding, but then climate health-related issues is not. So we need to actually do a synergy between NTDs and climate co-benefits. We also need to really look at the appropriate packaging of information and then capacity building for policymakers and stakeholders to access and use climate health research. Now, access to data or information is a health equity issue, which I'm really emphasizing. This is a health equity issue, and then that hinders translation of available health research evidence into practice. So acknowledging and addressing different capacities among countries through collaborative partnerships is very imperative in helping to address climate health co-benefits. So these areas we really need to look at when we want to really promote partnerships and also translate research evidence into practice. So I would like to just add the NTD strategy the ARNTD strategy in terms of addressing NTDs and climate co-benefits. With the vision of the ARNTD, we look at an African continent free of NTDs, enabling its population thrive in a healthy environment. So we are not looking at only the population, but also the environment that they live in. How does the environment affect their health? How does the climate impact contribute to disease spreading? How does their poverty status actually affect the disease spreading within their other communities? So the ARNTD expands through these areas and involves strategies that include strengthening capacity of researchers within the African context, stimulating South-to-South collaboration among partners, strengthening capacity and promoting mentorship, which is very important. So with the ARNTD strategy, we know that it is imperative to train young and early career researchers to come into the research field, to come into the NTD field, and also mobilize with them to work with the climate health co-benefits. So that's an element that the ARNTD builds up on. Now, the ARNTD works not in isolation. As we are discussing the partnerships here, partnership is very important in the activities of the ARNTD. We work with various organizations, including the World Health Organization, the USAID, ASCENT, the Wildlife Conservation Society, with a whole lot. So partnership is very important for the ARNTD in particular, and which I advocate that anybody working within the health and climate co-benefits really need to work in partnership and work in tandem with other collaborators to expand the interests and the views that we want to address to the local communities. Now, one of the main outputs of the partnership that the ARNTD has been able to develop is the Small Grants Program, which was launched in 2016 at the core NTD in Atlanta. This was received a support from the USAID through the core NTD, and we established a funding scheme with among the objectives to improve South-South communication and collaboration among researchers, policymakers, implementers, and community participation. Now we look at this, the ARNTD is focusing on collaboration partnerships from the grassroots to the national level. So we believe that researchers' work should not stay on the shelves, but rather we need to involve all the stakeholders that are needed to make sure that the research that is done is meeting the needs of the people on the ground, is meeting the needs of implementers, and is meeting the needs of other partners that are working in the same field. So the SGP program, since its inception, over the 5 years, have received grants and applications from over 1,500 applicants. And out of the about 1,500 applicants that we have, almost 1,500 applicants that we have received, about 600 awards have been given, totaling about $1.5 million. And most of the research that has been done include mitigation, including improving access to medication for climate-induced vulnerability populations, including migrants who suffer from climate-induced systems, including vulnerable populations, including the changes in the environment, how changes in the environment is affecting pathogen development, affecting the spread of diseases. So these elements, this research are all combining health and climate, looking at the impact of climate on health and looking at the health impacts also on the population. So the program has helped build capacity of awardees through partnership with other African countries and other countries in the Americas and European institutions. Now, awardees also work closely with their ministries of health, their veterinary services, and other ministries, including the NTD program, and make sure that results are often submitted to key stakeholders to inform program decisions. So awardees also present their findings at international conferences to make sure that this works. Now, the ARNTD SGP is a classical example of partnerships that is needed to promoting NTD and climate co-benefits. So what the ARNTD offers in terms of partnership, as we want to argue on, is that we provide a meeting place to discuss forums for funding organizations and institutions in Africa, including research institutions, including policymaking institutions. We also provide research and advocacy support to countries and various actors. And most importantly, we facilitate partnerships to promote mentorships. So partnerships is at the core of the activities of ARNTD. So in a nutshell, with the information provided, you need to understand that the choice to invest in NTD and climate co-benefit is ultimately political, but there is a need for strong collaboration and partnership between the NTD community and the climate sector to stimulate bottom-up approaches that will drive governments and other sectors to invest in climate resilient health systems. Now, the investment should be regional specific, should focus on national and regional priorities, and also adopt a human-based approach. And this is how we will be able to really help in mitigating the impacts that the vulnerable populations are facing in terms of NTDs and climate co-benefits. I will just stop here and we'll follow up with the discussions of other questions. Thank you very much.
Thank you very much, Mawuli, and it's really impressive to hear how far the African research on neglected tropical diseases, the network, has come. Really, it had its roots itself in a very collaborative philanthropic movement. So it's we hear your message loud and clear about partnerships, and thank you for sharing that with us. And in fact, thank you to all of our first three speakers for this. And perhaps if I could just invite Joelle to come back on screen with Mawuli for a few moments. And we have, of course, Vanina, who's also with us on the call, even though we can't see her on screen. Before we move on to hearing from our funders' perspective, I just really wanted to ask you all a question, thinking about everything that you've shared with us and what we heard. And that was really to do with, we've heard this call for partnerships and collaborating across diseases, sectors, but also countries. We heard that a lot yesterday when we were asking some of our fellow colleague researchers, what can we do? What's the best thing if we want to get started to bring climate and health together? And they all said, just collaborate, collaborate, collaborate. So from your point of view and your lens and your experience, anyone who's on the call today, who's listening into these presentations, what would be your advice and what could they do to facilitate and accelerate bringing climate and health closer? Perhaps Vanina, I'm just going in order of the speakers. If you would like to answer first, we have you on the call here.
Yeah. Okay. Thank you so much for this question. Listen, I think all of us this morning have made a passionate plea for more education, awareness, and advocacy to go to this issue. So first on education, philanthropy can play a specific role, but not just philanthropy, everyone can do this. And that's really around building the technical acumen of public servants working on climate issues. Mainstreaming climate education is going to be critical. Everyone here this morning is equipped with more knowledge. And I think that's already one thing that can be done. The second, I would say, is ensuring, as Joelle has highlighted, that we can foster policy environments and also equip civil society to fight climate change. So to foster policy environments, I think, again, us in philanthropy, we can help kickstart government efforts to build awareness of climate risk, but we can also collaborate together to create markets for low carbon technologies, and even encourage early stage research and development for decarbonization solutions. Well, as highlighted the need for more innovation on the diseases that are going to be most impacted by climate change. And again, supporting investments in this in a public-private session, I think is really something that everyone who's listening to us can contribute to.
Fantastic. Thank you so much, Vanina.
Yes, just to add to that, I think one of the starting points that we need to look at is the agenda setting. Now, we need to make sure that we bring partners right from the grassroots onto the table when we are actually setting the agenda. In most cases, sometimes the agenda is set above before we come to the people on the ground or the community on the ground and realize that their priorities are not mismatched. And therefore, when their priorities are mismatched, any intervention that is being done is difficult to be implemented. So we need to really bring this grassroots onto the leadership platform to in setting the agenda. And apart from that, we need to really involve governments in decision making, in partnership and advocacy. We need to raise the awareness on the government to really appreciate the gravity of it and health co-benefits, so that it's known that we don't tackle one, leave the other. Climate and health right now is becoming synonymous. Climate health is becoming synonymous with human health. Therefore, we, as the ARNTD we stand now, we are now really moving towards one health approach. So we need to really bring them on board, advocate the need to rather implement one health approaches in solving this problem. Thank you.
And thank you very much for bringing this back to the One Health approach, of course. Thank you, Mawuli. Joelle, would you like to add any thoughts to this?
I would say that I think for us, we're very interested in partnerships around that policy agenda. I think we should convince everyone on the call should convince their respective institution to get into the game. To get into the game, we need to clearly make sure these institutions have their own agenda back home to get to net zero, but also be willing to actually advocate for climate health connection to, let's say, the climate connection to innovation and climate sensitive diseases. And I encourage us to actually all connect with each other and start thinking of how coalition work could be helpful in planning for the next COP event, and how social media can be decisive in raising this issue as a core issue of climate adaptation. Over to you.
And thank you to our first three speakers for these really eye-opening presentations. Also a lot of food for thought and very concrete next steps and action points. So thank you. At this point, we're going to move on to the team from the Wellcome Trust, and through the funders lens to kind of see a little bit more about how we can move from the evidence base and all the way to that all-important decision-making and policy that we've been talking about. So I'd like to invite Dr. Jaspreet Turner, Dr. Isabel Fletcher, and Felipe Colon Gonzalez to join us on screen. I hope Isabel has been able to join. And in the meantime, while we just get her on board, Jaspreet, I hand the floor over to you, and thank you so much for joining us.
Hi, everyone. So I'm Jaspreet Turner. I'm a Senior Research Manager for Modelling at the Wellcome Trust. I joined Wellcome around 5 months ago, and prior to this, I worked in academia as an infectious disease modeller on various infectious disease areas. So it's great to be here today presenting our modelling strategy at Wellcome, and more specifically presenting how we look at climate and infectious disease and how that fits in within the strategy that we've developed. I wanted to start with a bit of background into what we do at Wellcome. Our main aim is to improve health for everyone by funding research, building global partnerships and advocacy campaigns to support science. We work with key stakeholders to solve health challenges using science. And our main funding areas are broken into 4 themes. So we have discovery research, which focuses on life, health and well-being, as well as 3 core health challenge areas, which I'll go into more detail in the next slide that I have. Okay, so our 3 core challenge areas are infectious disease, climate and health, and mental health. And at the center of this, we have discovery research, all of which is supported by the surrounding areas. And it's important to say that these are not independent, and we have lots of cross-working between these areas as well as cross-cutting teams. So focusing in on the infectious disease area, we have 4 teams. We have an epidemics and epidemiology team, a prevention team, an intervention team, and a health systems and environment team. So I sit within the health systems and environment team, leading on the modelling strategy, but modelling is an area that cuts across much of the work that's going on in the other teams and strongly aligns with our wider infectious disease strategy. My colleague Emma Maynard will be presenting in today's late afternoon session, and she's also in the health systems and environment team with more of a focus on infection and climate. Also on the slide, you'll see 3 orange boxes, and these are our dedicated cross-cutting teams, which includes data for science and health. And my colleagues Isabel and Felipe will be presenting more detail on what this team does in the following presentations as well. So going into what the challenge is and what we are trying to address in the infectious disease area, we know that the spread and outbreaks of infectious diseases are increasing, and COVID-19 has been a prime example of this. We also know in the context of climate change that we're seeing more outbreaks of diseases, particularly vector-borne diseases. Hence, our focus is to move from a responsive state to a preventative state, thereby preventing and eventually stopping future escalations of infectious disease. To do this, we need to understand the causes and drivers of escalation. And for climate in particular, we need to build up that evidence base that's required for policy and decision makers to improve our understanding of climate change, as well as the relationship between climate and infectious disease. Important that we ensure that the interventions we're focusing on and recommending are sustainable and affordable in limited resource settings. So sustainability and equity are core in everything that we do. We also focus on the communities most affected by the infectious diseases that we study. So ultimately, if we're able to identify infectious disease, we can then prevent diseases before they escalate. And this leads on to our vision, which is a world in which there is a reduced impact and risk of escalating infectious disease. So moving into a bit of the modelling side, our modelling strategy at Wellcome is fairly new. It's been developed over the past 4 or 5 months, and we developed it through having lots of scoping discussions to gauge where the key gaps were and where modelling could have the greatest impact. So through the scoping discussions, we had lots of discussions internally at Wellcome to make sure that the strategy would align with what the wider infectious disease team are doing. And then externally, we reached out to lots of researchers. So this included infectious disease modelers, statisticians, health economists, talking to other funders in the space, as well as non-governmental organisations. We also talked to drug and vaccine companies and policymakers as well to see where they thought those key gaps were, where we could have a high impact. And importantly, we also wanted to ensure that the modelling strategy aligned strongly with our wider infectious disease strategy and also the work that the Data for Science and Health team are doing as well. So I've gone over what the challenge is that we're trying to tackle, and now I'll go into how we're using modelling to tackle this. So our strategy is structured into 4 main themes. The first area is focused in on transmission and control. So specifically, we're looking at modelling transmission dynamics and control strategies to help understand causes and drivers of infectious diseases. And climate very strongly ties into this one, because we know that transmission dynamics will change under different climate scenarios. And we're then looking at what will the optimal control strategies be under these specific climate change scenarios, and how do we adapt and control transmission during those settings. Within this point, we also look at modelling surveillance strategies and what the optimal surveillance strategy will be, as well as the climate point that I touched upon. So the second point here is all about bringing in the health economic modelling aspect, which is very important for policy and decision makers, because showing that the interventions or control strategies we're recommending are cost effective allows us to build up that evidence base that's required for adoption. The third theme is quite focused on the technical aspects. So it's all about development of the tools that we need and also filling the gaps. So by collecting data, we'll also be able to validate our model predictions and be more certain with the predictions or recommendations that we're making. So the fourth theme there is tied very strongly to tackling some of the barriers that we tend to see with modelling uptake and trying to reduce the barriers and improve the uptake of modelling results. It also ties in strongly to the capacity strengthening aspect that we're also keen to build up. So this fourth point is all about encouraging adoption of the tools and promoting quantitative decision making, particularly in the low middle income countries where many of these diseases have the highest burden and impact. So going into a few examples of how climate specifically fits into our modelling strategy and some examples of the areas that we're interested in. I've listed a few points here on the slide, but it's important to note that this is not an exhaustive list, and there are, of course, other areas that we're still discovering or gaps that we're still identifying in this space. So in terms of transmission dynamics, we're interested in looking at how disease burden changes over time under different climate change scenarios, and also tied to that, looking at how the at-risk population size will change. Also, in terms of what the optimal surveillance is and what's required for us in order to prevent outbreaks from occurring. And then, of course, what are the optimal control strategies under climate change scenarios? In terms of the climate side, there is a need for better climate projections over time, particularly at a more granular scale, which will then allow us to also have better informed models and modelling recommendations coming out of the modelling tools. In terms of other climate aspects, we need a better understanding of seasonality. So examples here are dengue and malaria, and we know they have a relationship with rainfall, but kind of looking into those relationships further. And then tied to kind of the other end, we have extreme climate events such as floods. And we know these are likely to lead to kind of big outbreaks of diseases such as cholera. So looking more into that relationship as well. I then have a point there on the health economic side. So this is kind of bringing everything together and adding in that cost component. So we're then looking at how all of these factors impact allocation of limited resources and looking at the cost effectiveness of strategies that are being recommended by the models. In terms of the methodology, there needs to be more done in terms of incorporating climate effects into transmission models and coupling these two areas together. And then also on the data collection side, we know that models are only as good as the data that's used to inform them. So it's really important that we also collect the data that's needed to improve and validate these model predictions. And then the last bullet point there is all around indirect effects. So things like population movement and the role that plays in disease transmission, also looking at land use change and socioeconomic development. So I know there's been a bit of work done on soil transmitted helminths in this space and how transmission of that disease will change, but also what this means for diseases like schistosomiasis, which have snail vector. So with land use change, it will also be interesting to look into what that means for transmission of schisto. So on this slide, you should see a small green box. And this kind of highlights examples of work that we've very recently started and initiated in this area. So we're quite excited about. So we're looking into vaccine preventable climate sensitive diseases and what the optimal control strategy will be under climate change scenarios. Also looking into early warning systems, which will allow us to detect and prevent outbreaks. And an example disease of where we're looking at this is dengue. And then on the vector control technology aspect, we're doing lots of fun work in that space as well. And once these technologies are further down the line, it will be important to then bring in some of the modeling components as well. So looking at things like the cost effectiveness and where we should best target these new technologies. And Emma will touch upon kind of the main vector control technologies and what we're looking at in the space as well in the late afternoon session today. So overall, there is lots of modelling work to be done in this area, and I wanted to echo like the other speakers have from earlier this morning, that collaboration in this space will be important. And my colleagues Isabel and Felipe will also touch on more of this in the next talks that are coming up as well. And just wanted to end by saying thank you all for listening. And I look forward to any discussion questions as well.
Thank you, Jaspreet. Such a useful and important overview of a lot of the research gaps and also areas of interest where funders are looking to kind of push forward, and also working in this field on where the main research gaps that you see. So thank you for that. As you said, we'll move on to Isabel's presentation now.
Morning or afternoon, everyone, wherever you are. So my name's Isabel Fletcher. I'm a technology manager for the Data for Science and Health team at the Wellcome Trust. And prior to that, I was doing my PhD research at the London School of Hygiene and Tropical Medicine on climate and mosquito-borne diseases. And Jaspreet gave a really nice intro to Wellcome and the Infectious Diseases Challenge. So I'll be delving a bit deeper into some of the examples of research that we have and are funding to improve the methodology for studying and researching the impacts of climate on health, and also how we are creating better data, methods and tools for this research. So can we go on to the next slide, please? Great, thank you. So I just thought I'd start with some background on the types of methodologies that we're talking about here and how exactly this climate data is used. So climate services are a really good example of how these data are used in the health sector and how they can be developed to provide improved decision-making for the control of climate-sensitive infectious diseases. So climate services are usually organizations, data, tools or products or even processes that turn that raw data into something that is actually useful. So for example, early warning systems. And the point here to make is that they require a lot of co-development and multidisciplinary partnerships, including with climate expertise and also with the health sector. So can we move to the next slide, please? So climate data services are mostly informed by Earth observations, which are really valuable tools for investigating climate disease relationships. And these include remotely sensed observations from satellites that we can see that are spinning around the globe, but also on the ground observations, including those from local weather stations or from drones. So there are a number of ways that we can obtain these Earth observations, particularly through what we call global products. And this can give us really useful information about the global climate system, but also about land cover processes. But what we don't know is how well these global products can represent local ground truth conditions and which product is actually the best one to select for a specific purpose or climate service. So if we can go on to the next slide, please. So this is a study that really showed the importance of choosing the right global climate product. So this study actually showed that some climate data isn't always fit for purpose and doesn't always represent exactly what you think it is representing. So if we go on to the next slide, please. So this study found that by using different global climate data products to inform a climate disease model, you might actually get different outcomes depending on the type of data that you used. And this study found that this was because these global products weren't accurately representing what we called ground truth conditions for a variety of reasons. So if we go on to the next slide, please. So how is Wellcome helping to plug this gap in climate data and climate data services? So I'm going to show you a couple of examples of some of the research that we have funded to do this. So can we go to the next slide, please? So an excellent example that we've recently funded is the Harmonize project, which is led by Professor Rachel Lowe at the Barcelona Supercomputing Center and various partners in Latin America and the Caribbean. And this aims to really plug this gap of environmental data in lower middle income countries, specifically in climate change hotspots. So they plan to overcome the challenges associated with choosing global climate data products and collect local ground truth data using local weather sensors and also drones in order to more accurately depict the conditions that are on the ground. These data will then be packaged up into bespoke toolkits for 4 different contexts, including to develop a seasonal dengue early warning system for Brazil. They are also collaborating with various stakeholders and local communities for public engagement campaigns to ensure a two-way knowledge exchange with users of these toolkits so they can be really fit for purpose. Next slide, please. Another really interesting project we are funding is being led by the Office for National Statistics in the UK, and they plan to improve our ability to track the health impacts of climate change. So in collaboration with some partners, including those in Africa, they are developing a reporting framework for the statistics community to develop these official statistics on climate and health. And they also plan to provide an open source toolkit to aid this reporting and allow users to actually use these metrics. Next slide, please. So another major issue in climate sensitive diseases that we are tackling with data is we have a portfolio of projects aimed at improving the linkages between climate and health data, which is a really big problem at the moment. So if we go on to the next slide. An example of this work is we have commissioned WorldPop at the University of Southampton to develop what we call shape files for longitudinal population studies. And these studies are really valuable to both the health and climate community because these studies look at multiple aspects of population health over a really long time period. And so the development of these shape files will help integrate these 2 types of health data and climate data in an easier way for them to be used in analyses. And as we can see on the screen, they are also in the process of creating a really nice visual portal to view and interrogate these data, as well as provide both the data and the shape files to be available to both the climate and health communities. So next slide, please. Secondary to this, we have also recently funded the Centre for Data Knowledge Integration for Health, or CDAX, led by Professor Mauricio Barreto at Fiocruz in Brazil, which is also in collaboration with the London School of Hygiene Tropical Medicine. And they plan to create a health and environmental data platform, which is the objective of conducting interdisciplinary research on population health, and they will use integrated national Brazilian databases that already exist to generate new scientific knowledge on the links between climate and health, but also provide important evidence to support public policy making across Brazil. They also plan to be global leaders in harnessing these existing databases by integrating them to evaluate the impact of social protection policies on health and health inequities. They also will be global leaders in data governance by making these data assets available to the global health community. So if we go to the next slide, please. We are also working on increasing the technical capacity in users who most need climate data expertise, so in climate change hotspots. So next slide, please. So we have also funded a company called data.org to support their climate and health capacity accelerator network. And during this project, they will work with various partners in sub-Saharan Africa and India to establish hubs to train up-and-coming data professionals with the interdisciplinary skills they need to work at this really interesting intersection of climate and health. And next slide. And finally, just to round off about what we're going to be doing in the near future. So we are also embarking on a series of projects to increase access to climate data for health research. So next slide, please. So no spoilers today, but please watch this space. And if you have any questions, please contact us. Next slide. So thank you very much for listening, and I'm happy to have some discussion later.
Thank you so much, Isabel. That's a really great kind of database of resources that are there for colleagues to use. And you left us on that complete cliffhanger about the equitable data access. So we can't wait to find out more about that. Thank you so much. I'll just quickly pass over to Felipe for the last presentation from our colleagues at the Wellcome Trust. Felipe, over to you. Thank you so much.
Hi, thank you very much. Well, my name is Felipe Colon, and I am a technology lead in the Data for Science and Health team within the Wellcome Trust. And today I'm going to be talking about continuing with the line of thought that Jaspreet and Isabel have started. What is the importance of generating robust evidence for influencing policy and decision making? So climate, as we have seen in the previous presentations from yesterday, limits the geographical range, the timing, the magnitude of vector-borne disease transmission. And this is particularly through the impacts on both the vector and the pathogens they transmit. In general, we can say that warmer temperatures create more opportunities for vector-borne diseases to thrive. As you may have seen from other talks, temperature is not the only climate driver of diseases. There are other complex interactions with, for example, humidity or rainfall that are also important for diseases to be established, emerge or re-emerge in some areas. And so understanding the effects of climate change on vector-borne diseases allows us to anticipate potential changes in the risk of emerging of these diseases, and it also allows us to engineer or start proposing effective responses. Now, when we talk about climate and health, we are not talking about a singularity of a singular problem. We are talking about a variety of problems. And we will not know what the problems are unless we have data to identify them and to study them. We will also not know how to solve them unless we have sufficient data to understand what has happened, to visualize the relationships between the different factors, and to understand how these relationships interact with one another. And so data allows us to make decisions based on evidence to establish theories about what's going on and potentially identify solutions to these problems. Data in general can save lives, as has been demonstrated by the use of data in the current pandemic. As Dr. Tedros says, viruses move fast, but data can move even faster. The problem is that data generation is quite costly and time-consuming, and sometimes faces some barriers in terms of governance. We cannot just fill the data gap by collecting data once, because it will get outdated very quickly. So we need to think about sustainable mechanisms to produce up-to-date data that is reusable and that has long-term value. And preferably, we want to think about generating this evidence in real time. Another issue that we need to address in this space is that we need more data to attribute climate impacts. At the moment, for example, the World Health Organization's verbal autopsy has no questions on environmental risk factors. And so, for example, if a person dies today in Karachi, in the middle of the street, we will have information about probably a heart attack or a pulmonary arrest, but we will have no information to determine whether they died on a particularly hot day. And so this inability to attribute climate impacts on health is something that we need to start thinking about. Equally, if an NTD starts increasing its incidence after an extreme weather event, at the moment, we have very little evidence to attribute what proportion of this increase is due to climate or climate change. So we need better methods to quantify the proportion of NTD cases that are attributable to climate change. Currently, there is a limited number of tools that we can use to attribute climate change impacts on health. And those that exist are generated just for a handful of health metrics, and they are particularly for analyzing impacts on the global north. In addition, large volumes of literature are generated every day with increased diversity. And so it is extremely challenging to synthesize and curate the evidence using conventional methods such as systematic reviews because they are resource intensive. Therefore, there is great potential for evidence synthesis and curation using automated methods and machine learning. But there is no point in generating data and tools without having people to use them. So we need to address how we educate, how we train, and how we upskill the new generation of data scientists so that they can make use of this data and tools that we have generated. We need more talent, particularly in the global south, and we need to have a greater representation of female scientists and people from the global south. So what are we doing at Wellcome at the moment? Well, as Isabel pointed out, we have invested $6.8 million to for a grant allocated to data.org to increase data science capacity in the global south. And one of the key aspects of this project is that it will increase female representation in the field of data science. We are going to allocate up to £15 million to the development of digital tools to aid climate-sensitive infectious disease modeling. And we will also, part of this money is going to be allocated for developing a community of practice where different stakeholders, including the modelers, can talk to each other and understand how to better address topics and complex issues in the space. We have allocated £5 million to the development of transparent and generalizable climate and health metrics that were allocated to the Office for National Statistics. And we are going to be working on trying to understand and address what are the opportunities for climate change attribution on health and how to generate methods and tools for curating living evidence. We are going to be working on this space over the next years, but I cannot provide more details than that at the moment. And with this, I finish my presentation, and I'm happy to get any questions.
Thank you so much, Felipe, and thank you to our three presenters from Wellcome. So obviously a really, really important supporter of all those seeking to work in this field. And it was really nice to hear as well that you're pushing forward for more female scientists to participate and for the Global South, which is something we talked about a lot yesterday. So that was really inspiring. Before we kind of wrap up the session, we I just perhaps wanted to ask a few questions on behalf of some of those tuning in today. So if anybody would like to engage more with the themes and the work and the support that you're offering at Wellcome Trust, what are your plans? Obviously you had a first round of funding, as you just explained. Are you looking to refine that over the months or years, or how can anyone interested to discuss this with you, sort of what are your next steps?
Well, what I would suggest is to keep an eye on the welcome page. We are going to have many funding opportunities coming soon in different relevant topics for the neglected tropical disease space. So unfortunately, things haven't been materialized to the level where I can share more details than this. My suggestion is to keep an eye on the page, and we will be more than happy to discuss any potential ideas if they contact us by email. We are always happy to talk to researchers to see whether we can support them on their plans for generating knowledge. So we're more than happy to discuss any ideas on that.
Super. And for anybody who'd like to know a bit more about modeling on climate-sensitive infectious diseases, we did have a shorter session, one of our ISNTD Connect meetings with colleagues from the Wellcome Trust. I've just put in the chat the link to the YouTube recording of that session. So that's kind of a 1.5 hour overview of all your work. As we are coming up to the end of the time that we have for these issues, looking at partnerships, just thinking a little bit about the modeling aspect that you're so focused on at Wellcome Trust. What would be some of your learnings or advice in terms of going from a model to a tool that can be adopted by a municipality or a government? What advice could you give, or what have you seen working successfully? What are the most important factors there?
I think one of the key things is to make sure that you are involving the end users in the process of generating the tools. Mm-hmm. What we have seen is that in many cases, many tools and many great tools are developed, but if they do not consider the point of view of the end user, they may end up being not adopted. So having people that are going to be using your tools since the onset of the project is going to be very beneficial.
Thank you.
I don't know if you want to add something, Isabel.
Yeah, I'd just like to add that, that's something that we've been thinking about for quite a while, both me and Felipe, but also at Wellcome as well, is how you take that tool and actually translate it into something that people can use. And we're actually doing a project in collaboration with Gates Ventures to understand the barriers specifically for implementation of climate sensitive disease early warning systems. So that will be a core piece of work where we really will understand, okay, what are the things that really need to be done in order to get a successful tool and have it routinely used for policy making and within the health sector.
Brilliant, thank you. We are 5 minutes over. There was one very quick question in the Q&A about the models, if you have time for that. It's a question from Lahiro Kodituwaku asking, do you have any models that have incorporated human mobility in infectious disease transmission? And perhaps we can open that question up in terms of including variables in your model. Obviously, it's such a complex and multi-layered theme, climate change, all the way from migration and land use and all the things we've discussed today. So where do you draw the line? First of all, have you included human mobility? And also, where can we draw the line when thinking about these models as researchers?
I can start building on that, if I may. In my previous role as an assistant professor at the London School of Hygiene and Tropical Medicine, we did generate some models that incorporated human mobility for infectious disease transmission, particularly tailored for dengue. At the moment, within the Wellcome Trust, we are funding one project for developing a dengue early warning system in Vietnam that is going to be probably one of the first, if not the first, dengue early warning system that is going to be evaluated using a randomized controlled trial. And the part of the proposal includes possibly incorporating also human mobility data. That still needs to be evaluated for its potential ability to help them predict dengue cases, but part of the idea is to incorporate metrics for this, but that's still work in progress. But definitely this can be done. This has been done for several other diseases. And while we do not have those models within Wellcome, we can probably put you in touch with researchers that are working on this space for you to interact with them.
Well, yesterday we did have a whole session that focused really on modeling with including Professor Rachel Lowe that you mentioned and the Barcelona Supercomputing Center's colleagues from there. So to anyone in the audience who's interested to hear more, that recording will become available. We have reached the end of the time allocated for this very kind of packed and very informative, inspiring session, all the way from our first three speakers, giving us so much food for thought on how to go about the partnerships, what they've done, but also what the main gaps remain, all the way to the funding and the support, not just a funder's support, rather, not just in terms of funding, but also your guidance and your huge expertise at Wellcome. So it's been a very rich session. Thank you for joining us for this session. And most importantly, a huge thank you to our amazing speakers for the last 2 hours. It's been a really enriching session. Thank you very much.